What's up, you guys? It's your boy Miguel giving you your daily dose of radiation, and today's video we're covering is being an X-ray tech the right choice for you. So to give you context, I am a night shift X-ray tech, been doing it for 4 years, work a lot of overtime, so I dabble in day shift. So to give you more context, in my family, I am surrounded by different medical people in different various aspects. So to give you context, my lady is a nurse. Her cousin is physical therapy tech. Her somewhere down the line of her cousins is an ultrasound tech. And then another one is, I believe, involved in the nurse practice world. Somewhere over there. But like essentially we're covering like all the more basic, not doctors, but like more basic general medical, like entry level medical professions. Because obviously if you're watching this video, you want to know like, hey, should I be an X-ray tech or should I be a nurse? Those are some of the more common ones. So I would say when we sit down and we talk about, what's going on with our jobs, or I sit down and I listen to my lady's friends who are all nurses over there, I would say out of all the professions we have, I as an X-ray tech have one of the most best jobs out of everyone as far as like the schedule, like the responsibility, and like the stuff I have to do is like I'm like, it is stressful, but not stressful when you think about the other people, especially like when you're in work and you see what everyone else does, respiratory, nurses, doctor, and you see how stressful they are all the time and the amount of stuff, because like you sit there and then you see all the stuff they do and then you're like, dang, I have a good job. Because like sometimes they're busy and we're busy, but our busy is different. Because like if they got like, let's say they got 5 patients, let's say for like a nurse, they have like 5 patients. We have 5 X-ray orders on different patients. It will literally, if there's no nurses in there, we can go and it's just a one view chest, 30 seconds to a minute with each patient, and then we'll be done with them. We'll document it from head to start, document what we saw, and be done. And like maybe 10 minutes tops, we'll be done with everyone. That's from start all the way to finish. Versus if you're a nurse, you have to take care of these people, get their whole brief summary, go talk to the doctor, see what's going on, draw blood, like insert more like heavily detailed informations, keep track with juggle. Like if you're in the ER, you have to juggle depending how busy it is. I've seen like 1 to 3, maybe 4 patients, depending how big your emergency room is. Like those patients, you have to juggle all of them, constantly go back and forth if they want something or if they're not doing good, keeping up with the report, discharging, or giving report to the other shift nurse who transitions. Like we don't have to do that. Literally, when the other crew comes in, they're like, hey, is everything working? We're like, yes. Is there something you didn't shoot? No. Or yes. That's it. You just keep it pushing. Like literally our report transition within 1 minute tops. Versus nurses, I've seen them where they will sit there at 8 o'clock and they won't leave for like between 15 to even 30 minutes just going back and forth. Like it's wild how much more they do than us. Now granted, pay wise, nurses do slightly make more than us depending on your level of credentials. Like I would say if you're just a basic X-ray tech versus a basic RN, the RNs would make a little bit more than us. And then to complete with like a BSRN, you would probably have to move up to maybe CAT scan to be able to compete with their pay. But right now, since I work night shift and my lady's just a basic like regular nurse, I technically make more money, but like because I work nights and all and some weekends and stuff like that. So I am technically making more money at the moment. But I would say I am less stressed than my lady is as a nurse. She's constantly telling me all this stuff that she has to deal with work, and I'm like, I can't relate. Like I'm living right now. School is like the hardest part within all the professions. School is the hardest part. And the work is slightly, being a nurse slightly gets better, but it's still stressful. For me, the hardest part for me was literally going through the school. After that, right now, I'm living my best life. Like, it is nowhere challenging. Occasionally, the biggest problem we face as X-ray tech is more situational, is especially for nights, is there going to be an update that the network goes down, so you have to do everything manual? Is there going to report? Is there like, do you have the good portable? Or do we have to bring everything to the room? Do we have the good doctors running the ER? Like, how do you manage the flow of work? What techs do you have working with you? Because once again, all those are little small variables. Still doesn't change the whole aspect, but it makes the workflow, differently. But like, literally, those are small, insignificant things compared to the actual profession as itself. I personally would recommend it for anyone, but I know there's certain people who feel like they want to, because we don't, as X-ray techs, we are at the very bottom of like gratitude, as far as like, oh, thank you for helping me. Like we're at the very bottom. No one really thinks about us unless they can't breathe or they're like gunshot. Like as far as gratitude goes, like we're not going to get that in our department. And even as far as the hospital in general, the radiology department's at the very bottom. Like, you're not not that you're not important, but as far as like, it's if you do it, you'll understand. You're like the foster kid. Like, you're like the Harry Potter living in the room at the bottom of the hospital. Like, you're kind of like the bottom type situation. So I would say I'd recommend it for anyone, especially if you want to dip your toes in the field and you want to do it, but you don't want to get like too deep in it. I would say if you do x-rays and you're in the main, you are more hands-on as far as like enemas and like other GI stuff. Like, it does get more like what I would call, quote unquote, more like nurse type situation, where you're doing more patient care and like you're responsible, and like it does, if you do that your responsibility and how difficult stuff could be, I've seen it has gone up. So you should watch out for those. I would say, I personally, as a night shift tech, I don't really get involved in fluoroscopy, because at nighttime at our trauma 3, we don't have any kind of doctors, radiologists on site doing stuff. So we're not really involved in that world. So I think that's good. So we just mainly do x-rays, and then occasionally we have to do some like upper GIs and like other exams like that. So, but yeah, it's pretty where we go. See you on the next one.